A torn tendon can take away simple movements, like lifting your arm, bending a finger, or pushing off your foot. Tendons are strong cords that connect muscle to bone. When one tears, the muscle can no longer move the joint properly. Surgery reconnects the tendon, either stitching torn ends together or reattaching the tendon back onto the bone. Doctors commonly recommend surgery for complete tears, tendons pulled off the bone, or cuts that divide the tendon. The most common tendon repairs are in the shoulder rotator cuff, the Achilles heel, the knee, and the hand. Many rotator cuff and knee repairs use keyhole surgery, small incisions, a tiny camera, and specialized instruments inside the joint. Open surgery uses one longer incision. Surgeons often choose it for hand tendons, complex tears, or when a graft is needed. For older tears where tendon ends have retracted, a graft may bridge the gap using tissue from the patient, a donor, or synthetic material. After surgery, the repaired tendon needs protection. A sling, brace, or boot holds the joint safely while healing begins. Physiotherapy is the foundation of recovery, starting with gentle passive movement, progressing to active motion, then careful strengthening. Light daily activity often returns within 1 to 3 months. Return to sport or heavy work usually takes 6 to 9 months. Risks include infection, stiffness, and re-rupture. Returning to heavy activity too early is a leading cause of the tendon tearing again. Most patients regain useful function with less pain and better strength, especially when they follow the full rehabilitation plan. Did you know you can get this treatment abroad at the same quality you'd get in the US or Europe for a fraction of the cost?
Ginger Healthcare is one of the world's most trusted medical travel companies. It helps patients to find safe and affordable care in India, Thailand, Turkey, Singapore, Dubai, Malaysia, and more. Visit ginger.healthcare or check the description for details.